Hello, everyone. Happy Memorial Day weekend. This is Dr. Michael Greger coming to you live from my treadmill. Every month I'm doing live Q&As on Facebook and YouTube. Just did Facebook a little bit of time ago. And now here on YouTube, for those of you who are familiar with my work, every year, every issue of every English language nutrition journal on the planet, so busy folks like you don't have to. And then compile the most interesting, most groundbreaking, most practical findings to new videos and articles uploaded every day to my nonprofit site, NutritionFacts.org. Everything on the website is free. There are no ads, no commercial sponsorships, and no corporate sponsorships, strictly non-commercial, not selling anything. Just put it up as a public service, as a labor of love, as a tribute to my grandmother, actually, who's the reason why I became a doctor in the first place, and the reason I practice the type of medicine I practice today, which is lifestyle medicine. Happy to answer your questions. I'm going to go and just start at the top of the list and go down. There were some smart folks here already piling on the questions before it even started. That's a good way to get your question answered. Start at the top with No Exit Love Now says, so many health foods contain manganese. And it all adds up. Do we have to worry about getting too much manganese? I think the only source that I've seen that would be a problem is a hibiscus tea. It's such an extraordinarily high manganese content that I'd encourage people not to drink more than a quart a day. It's about 1 liter, 4 cups a day. But hibiscus tea, one of the 3 healthiest beverages. That's water, hibiscus tea, this herbal tea, which can bring down blood pressures, have all sorts of other wonderful benefits, and then green or white tea. But there are certain green tea limits based on fluoride content and based on lead content if it's imported from China. And depending on whether you eat it or not, depending on whether you're a kid, depending on whether you're pregnant, I've got videos and all that. Just type in lead and tea, pop right up to see how much is too much. And for hibiscus tea, just a little heavy on the manganese. So you want to moderate your intake. But still drink it. It's fantastic. I have a pitcher brewing as we speak. What a fantastic, refreshing summer drink. For those of us in the Northern Hemisphere, but for all our Southern Hemispherians, happy winter, which is starting in 4 days for you. What brand of B12 do I take? Vitamin B12 is critical to get a regular, reliable source. I encourage people to get the cheapest source. And so whatever's cheapest, that's what I take. The Astronomy Freak 95 asks, despite sweet potatoes being healthier, would I consider white potatoes a health food, part of a healthy diet? As I mentioned on Facebook, foods aren't healthy or unhealthy per se. They're healthier or less healthy. And so are white potatoes healthy compared to sweet potatoes? No. Compared to, ho-hos, yes. And so if you have access to either, you're at the grocery store, so white potatoes there, sweet potatoes there, choose sweet potato. And then if you have orange sweet potatoes or purple sweet potatoes, choose the purple sweet potatoes, right? Might as well, just like, is green cabbage not good for you? Well, purple cabbage is better. I'm not saying green cabbage is bad for you, but compared to purple, not as good, so you might as well go for it. Vlad asks, Vlad from Romania asks, doesn't ask anything, just says they sent me an email. Okay. Cynthia says cyanocobalamin or methylcobalamin for vitamin B12, and the answer is cyanocobalamin unless you are a heavy smoker or are in kidney failure, or center your diets around cassava. In which case, you should stop all 3 of those, if possible, and stick with cyanocobalamin. Okay, BJK says that his or her mom been following healthy plant-based, my daily dozen recommendations, and eating the same foods, but she is experiencing bloating. So what should we do? Well, some people are intolerant to certain foods. Depending, you say, wait a second, you're eating the same foods. How could it cause different effects? Well, we each have different gut microbiomes. We each have different good bacteria in our gut. And so presumably if you eat the same foods, you'll foster pretty much the similar types of bacteria, the growth of similar types of bacteria. And so if after eating a year like this, you should have lots of fiber-eating bacteria and resistant starch-eating bacteria, and they should take care of all this stuff, and you should be wonderfully healthy. But if you're bloated, then obviously your one possibility is that your microbiome is just not happy with something. Another thing is a food intolerance kind of thing. If it's so, I would, one thing she could do is she could experiment. So she could do what's called Elimination Diet, where you basically stop eating everything except tapioca, sweet potatoes, and water, which is essentially no one's intolerant to, and then start adding food slowly back into your diet and see if it causes problems. For example, you could be gluten intolerant. So if you start eating bread and all of a sudden you feel bad, then that may be a sign. Although, of course, you'd want to make sure you didn't have something called celiac disease, which is a serious disease, and you'd want to get tested for before just going on a gluten-free diet. John has a daughter with heavy periods and thinks she may need to eat meat. What should John tell her? Well, as with anything, you have to treat the cause. Why? So presumably this is a question about iron. If you're losing so much iron, might you want to eat meat, which has very, very readily absorbable iron in it? Well, what you do is you treat the cause. Well, I mean, why is she having such heavy periods? Does she have fibroid tumors? Eating something like ginger, which is found not only to fight painful menstruation, but actually decrease flow significantly. Maybe that would take care of itself, and then you wouldn't be losing the iron and have to worry about iron. If, however, she really does have iron deficiency anemia, the answer is not to eat meat. The answer is to eat iron-rich plant foods like beans and greens, and eat vitamin C-rich foods, plant foods, along with those iron-rich plant foods to maximize absorption. So we're talking about tropical fruits and citrus fruits and broccoli, bell peppers, along with iron-rich foods, maximize the absorption of plant-based iron. You should get the best of both worlds, all the iron you need for blood formation, but without the negative aspects associated with excess meat consumption. Oh, and by the way, people that don't eat meat have no higher rates of iron deficiency anemia than people that do eat meat, but that's not saying much because the rates are pretty bad. I think about, depending on what population, about 1 in 7 reproductive age women, menstruating women, have iron deficiency anemia, and so may need to go out of their way to eat iron-rich foods, healthy iron-rich foods. BJK is back. Drinking water or herbal fruit teas best before, during, or after a meal, doesn't matter. It doesn't matter unless you're talking about a non-herbal tea. You're talking about black tea, green tea, or white tea, which can actually interfere with iron absorption, so you don't want to drink it with a meal. But these other, like fruit teas, something like hibiscus tea, you can drink with your meal, no problem. Smart Dogs asks, could I state the reasons for why smoking weed is bad for your health versus vaporizing? So any kind of smoke in your lungs is bad. Forest fire smoke, house fire smoke, incense, cigarette smoke, marijuana smoke. There are like polycyclic aromatic hydrocarbons, basically products of incomplete combustion, which are toxic. And so for people that want the effects of marijuana but don't want to suffer the adverse health consequences on one's respiratory tract, then vaporizing cannabis, where it's heated up to a point that doesn't actually combust, doesn't actually go into flames, but the THC, the kind of psychoactive component, is released at the same level as if you actually burned it and then it kind of comes up into a little balloon, and then you sniff up the kind of steam of the vapor, and you get the effects without these toxic components. You say, well, wait a second, what toxic components? What's the really thing to worry about? Chronic bronchitis. So a significant number of people who smoke weed, smoke marijuana, kind of on a regular basis, suffer from chronic bronchitis symptoms, such as excess phlegm production, chronic cough, shortness of breath. But the good news is that they go away. Those symptoms go away. So you stop, and they get better. As opposed to smoking, long-term smoking tobacco, we actually get something called chronic obstructive pulmonary disease, emphysema, a leading killer, though chronic marijuana consumption does not seem to lead to obstructive lung disease. And so it has reversible as opposed to irreversible scarring that you get with tobacco smoke. But you can still get these chronic bronchitis symptoms if introducing any kind of smoke into your lungs. BJK is back. Any concerns with homemade almond milk, which is basically crushed almonds in water, or even easier, you can take a spoonful of almond butter and just blend it with some water, and poof, instant almond milk. Of course, there's no fortification. Most almond milks on the market have added, fortified with calcium and vitamin D and B12, other things. Anyway. Does almond milk inhibit the cocoa flavonoids like dairy milk or soy milk might? And the answer is we don't know. So there's these experiments showing that one of the reasons you don't get the benefits of these cocoa flavonoids, don't get benefits of dark chocolate when you're eating milk chocolate in terms of improving artery function, is that these phytonutrients found in the cocoa mass itself, the cocoa, are bound up by the milk. Same thing with tea. When you add milk to tea, you bind up all those wonderful phytonutrients in tea. But it turns out the same thing appears to happen with soy milk. So maybe it's something to do with just a protein reaction. We're not sure. And so does it happen with almond milk? We simply don't know. Good question. If I find anything about it, I'll do a video about it. Johnny says, yeah, white potatoes are healthy. They have lots of vitamin C. Okay. Lots of things have vitamin C. I don't think anyone got scurvy because they didn't eat white potatoes. And sweet potatoes have vitamin C too. Smart Dogs is back asking, calcium supplements for osteopenia? Plants enough? Oh, so I actually have videos on whether or not calcium supplementation may prevent bone fractures. And so I think video one is, are calcium supplements effective? And another one, are calcium supplements safe, I believe. So check out those two videos. And if you're like me, you'll be surprised at the findings. Russell the Raw Man asks, what do I think about honey? It's interesting. I just did a video. I just scripted a video. So when I say I just scripted a video, it may not appear on the website for weeks. So you're like, wait a second. You said you just scripted it. I didn't see it on Monday or whatever. But that's just because there's a buffer. It's a whole process here. Just did a video about honey as a treatment for canker sores. What's called aphthous ulcers. Some people, most people get, canker sores once in a while, these little shallow ulcerations on like your inner lip. But some people get chronic, recurrent canker sores. It can be very painful, interfere with their quality of life. And so there's been a kind of a desperate search for things you can do about it. There's all sorts of drugs and things, laser treatments and all sorts of crazy things. But one of the most effective treatments I've ever been able to find was this amazing study using honey, basically a Q-tip dipped in honey. And they just rub the honey on the canker sore 3 times a day, something like that, and absolutely shocking results. Wait till you see the video. You will be impressed. But in terms of eating honey, it's sugar. It's like, eating, agave syrup or brown rice syrup or high fructose corn syrup or table sugar. lots of empty calories, which we don't need. We should have nutrition with our calories. And so I do not recommend eating honey. If, however, the only way you're going to drink that green tea is with some honey in it, it would probably, the benefits would, I mean, I'd want you to drink the, I'd want that teaspoon of sugar to make the medicine go down, in other words. But if you can drink green tea straight, even better, or white tea, even better than that. Ace Life asks, can a vegan health coach help better patients better than a traditional doctor? Okay. So if we're talking about, I mean, there's some things that doctors do awesome. Not, I mean, no. And so look, acute conditions. You break your leg, you want a doctor, you don't want a vegan health coach. You have an infection for which you need antibiotics, you want a doctor, not a vegan health coach. However, so for acute conditions, phenomenal. Again, a car accident, you know, you want a trauma surgeon. But actually about 80% of the things people see doctors for are chronic lifestyle diseases. And so if we want to treat the cause, if the cause is lifestyle, then the cause isn't a drug deficiency, isn't a surgery deficiency. Well, then traditional doctors may not be able to help as much as someone, even if they have no medical credentials or health credentials whatsoever, who will take you to the grocery store and say, this is the healthiest food right here. Let me show you the wonders of the produce aisle. May actually be better in terms of reducing one's chronic disease risk. And those are the leading killers, leading causes of death and disability. So, for example, the Global Burden of Disease Study, the largest study of disease risk factors in human history funded by the Bill and Melinda Gates Foundation. Number one cause of death in the United States is what we eat. Number one cause of disability in the United States, what we eat. Bumping tobacco smoking now to number two. Cigarettes only kill about 500,000 Americans every year, whereas our diet kills hundreds of thousands more. So obviously, diet is the number one thing taught in medical school, right? The number one thing your doctor talks about at every single visit, right? Wait a second. Unfortunately, the amount of nutrition education gotten in medical school and in continuing medical education is insufficient to deal with the ravages of chronic lifestyle diseases like type 2 diabetes and obesity and hypertension and high blood pressure, the heart disease. And so what we need is advice on healthy eating. And for that, a health coach may be better informed, vegan or not, than a doctor. And so you use what's good at, right? I mean, you don't take your dog to the auto mechanic, you take your dog to the vet, right? I mean, so if you have a problem, you take it to the right person. So if you have a problem with a lifestyle disease, then you need someone that can help you with your lifestyle. Ideally, you'd have a lifestyle medicine doctor who could offer the best of both worlds. All right. Chupacabra, I'm sorry if I mispronounced that, asks, eating healthy, exercising a lot, but still high blood pressure, 125 over 85. How can I get it down to 110 over 70? And for those of you thinking, wait a second, 125 over 85, that sounds pretty good to me. I mean, isn't the definition of high blood pressure like 140 over 90? So it sounds like they have normal blood pressure. Yeah, but having a normal blood pressure in a society where it's normal to drop dead from diseases like heart disease and stroke and kidney failure is not necessarily a good thing. In fact, shown that even people with so-called normal blood pressure, like 120 over 80, benefit from blood pressure reduction. So the ideal blood pressure, the no benefit from reducing it further blood pressure, 110 over 70. Wow, is it even possible to get down that low? Absolutely, if you eat and live right. Now, it sounds like this person is eating very well. So basically, if you're eating a plant-based diet, I would cut out processed foods, not add salt to one's diet, And if you still don't get down to an ideal, then I would move to add foods to your diet that specifically lower your blood pressure even further. For example, ground flax seeds and hibiscus tea should bring your pressures even lower, though you may be doing better than many Americans. In fact, most people over the age 60 are actually hypertensive, actually over 140 over 90. Nicole, the name of my favorite cousin, thanks me for everything I do. Thank you. You're absolutely welcome, Nicole. BJK is back, asks, possible to include too little sodium? You don't have to worry about eating too little sodium. There's a little bit of sodium in everything. And so just whole, healthy, natural plant foods should supply all the sodium one needs. NazFed asks, been on a plant-based diet for 4 years. How do I treat menopausal hot flashes without medications? Do I recommend hormone therapy? I do not recommend hormone therapy. For osteoporosis, do I recommend some of these injectable drugs? For menopausal hot flash symptoms, I'd recommend soy food consumption. If you just type in menopause in NutritionFacts.org, a couple of videos will come up and talk about the efficacy of soy foods for helping with that. So the reason I don't recommend hormone therapy is because whether it's those so-called plant-based hormones or not, these horse estrogen HRT therapies have been associated with increased risk of blood clots and breast cancer and heart attacks, and so I would not do that. For osteoporosis, good question. I have videos on preventing osteoporosis, but I don't have many videos on treating it. That is an area that I am going to do more videos on, and when I do, I will compare natural therapies to the current leading pharmacological approaches, and so stay tuned. BJK asks, following my daily dozen recommendations, one may get an excess of protein. Is that a concern? Excess of protein. But you're eating plant protein, right? I mean, so you get a lot of protein because you're eating legumes, beans, split peas, chickpeas, and lentils. I would not worry about eating too many legumes. Steve asks, is there a limit on the amount of dates one should eat on a whole food plant-based diet? I mean, the only kind of theoretical limit is that you eat so many dates because it's so calorically dense that you just kind of you only have about 2,000 calories in the calorie bank every day. Is that you would kind of push out other healthy foods from your diet. So I mean, if you ate 1,000 calories of dates, then you just maybe so that you're not going. You're satiated and you don't feel like eating that big salad. And so that's the only really concern. Dates are really healthy for you, but we should have dietary diversity to add all sorts of really healthy foods into our diet. Ace Life asks, what medical school program is good for poor kids? You mean like getting in like a medical school that poor kids can attend, a cheaper medical school? Usually state schools, so if you're in California, the state school system, I think they're all expensive. But it should be easy to get a loan. I mean, you get student loans. I mean, they just know that doctors make such obscene salaries that you'll be able to pay back whatever loans you get. And so everybody should be able to go to medical school. It's just a matter of how long it'll take you to then pay back your loans. BJK asks, nitrate plus vitamin C equals good. What about nitrate plus vitamin C plus fat from nuts and or seeds? From PubMed, fat transforms ascorbic acid from inhibiting to promoting acid catalyzed N-nitrization. I will check out that article and get back to you. Vlad asks, just says, I want you on my podcast. Naz asks, do you recommend drinking hard water or recommend water softeners or bottled water? I recommend drinking tap water straight from the faucet, although some plain carbon, activated carbon filter like Brita or Pure can make your water taste better, which will make you drink more of it, which is a good thing. Though I have a whole series, a series of videos coming out about arsenic and rice. I talk a little bit about arsenic and water in terms of if you live in an area which has high arsenic water, then you might think twice. But other than that, I think just straight tap water should be fine. BJK, is it safe to buy toothpaste containing calcium carbonate? No, that's just chalk. So the reason they add calcium carbonate is just as a mild abrasive. It's just powdered chalk, and so that is it safe? Yeah, I don't think there's anything. There's any downside to calcium carbonate. There is, however, I have some videos coming out about SLS, sodium lauryl sulfate, as an irritant. I'm increasing risk of, I forget what it was. Maybe that was part of the aphthous ulcer video series. Anyway, that's a concerning ingredient, not for cancer, which was some email fraud thing from the 90s, but as an irritant, I forget indications for what. Make sure you're subscribed to my emails, and of course, subscriptions are free. Everything is free, so you won't miss those videos coming up. Ace Life, do they think medical schools should lower the tuition fees? Tuition fees are pretty outrageous. I think I forget how much the tuition at Tufts was. I actually got a free ride through the medical science training program. Was offered a free ride. Actually ended up not taking it, but that's a whole nother story. Do I think they need to lower tuition fees? I'd like to see them lower their tuition fees. Most countries, medical school, like all graduate training, all college is free. But again, it shouldn't be a barrier since you can get any student loans you need and pay them off. Right. Harry asks, what is my take on intermittent fasting? Like 16 hours fasting, 8 hours feed window for diabetes? That's a fantastic question. And I'm going to do a whole series of videos about it. Because there's now a whole body of evidence, and there wasn't before last time I checked, but now there is. And it's not like I'm trying to hide anything from you. I just haven't read it. I have it all sitting in a folder. Looking forward to doing a series of videos. I know that's a topic of interest to folks, and so it's high on my list of priorities. Smart Dogs asks, when's the next Q&A? The next Q&A is, I believe, let me look, June 29th. Thursday, June 29th, at 12:30 and 1:30, 12:30 Facebook, 1:30 YouTube. Folk B asks, with people talking a lot about Soylent and lab-grown meat, do I think we'll ever be able to synthesize the complexity of plant foods? Well, nature does it, right? Takes a little seed, explodes into an oak tree, right? Everything just comes out, so there's no reason we won't be able to kind of figure it out one day. But the plants do all the work for us, and so no need to try to synthesize in the lab unless you're trying to patent something, because obviously you can't. until recently, you really can't patent much of life. I think Monsanto patented some broccoli strain or something, but most broccoli, unpatentable, which is good because then it's cheap, but it's bad because no one's going to do research on broccoli they can't make a lot of money out of. So we should support public funding of medical research through, for example, the National Institutes of Health. BJK asks, following the Daily Dozen guidelines. Oh, we already talked about that. Got it. Harry sends me an image of watermelon. That looks delicious. You're making me hungry. And it is 3:30. That brings us to a close. Sorry I didn't get to more of your comments. Or get those questions in early. In fact, the next YouTube event page is already up. You could put your questions in right now for June 29th and be sure you get them answered. Thanks, everyone, for joining me on this wonderful holiday weekend, and have a fantastic month, and I will hope to see you soon.